Welcome to Nutrition Rounds with Dr. Danielle Belardo, the podcast for anyone interested in learning about plant-based nutrition through an evidence-based approach. Every week, we share insights and interviews with physicians who are leading experts in nutrition and health. Whether you've been plant-based for many years or are still searching for the perfect diet, Nutrition Rounds will inspire and empower you to live your healthiest life backed by science. Now here's your host, Dr. Danielle Belardo, MD. Hello. You guys, today's episode of Nutrition Rounds is the highly anticipated episode all about plant-based keto. I'm super excited to jump in and tell you all about the two incredible physicians that are podcast guests today. But first, I just want to clear a few things up regarding keto in general. So I know a lot of you listening are already vegan. Many of you follow a low-fat, high-carb, plant-based diet, which works excellent for you. It works great for me as well. So for those of you who do, I would just ask that when you listen to this episode, you listen with an open mind. If a high-carb, low-fat, plant-based diet works for you, don't change it. But I would just love for you to have an open mind about other options in plant-based nutrition. And that's what this episode is all about exploring. So I know many of you listening are vegan and some of you are omnivore, and today some of you listening may be keto advocates. So I want to start off by saying if you've listened to my podcast over the last 8 months, you may have noticed that I've evolved quite a bit in my thoughts on nutrition. And it stemmed from my experience with real patients. So a few years ago, when I started my plant-based preventive cardiology clinic in fellowship, I advocated for all of my patients to follow a very low-fat, high-carb plant-based diet, which I continue to advocate for. And I've been blessed to see incredible results. My patients have lost weight, reversed type 2 diabetes, hypertension, hyperlipidemia, dropped medications, and they've been thriving. Many of my patients do amazing on a low-fat, high-carb, plant-based diet. But then I started to see some patients struggle on this formula. And it wasn't because they weren't trying and not because they were eating meat or processed foods. It was just because they found it hard to reach a calorie deficit despite eliminating oils, fats, and eating a high quantity of low-calorie, nutrient-dense plant-based foods. So we started to troubleshoot for these patients who struggled. We increased fiber. We made sure all processed foods, all oils were cut out. Some of my patients tried to add potato, like from the starch solution, etc. And despite how much insane success I've seen with many of my patients on a low-fat, high-carb, plant-based diet, I was confused and puzzled and, to be honest, a bit stressed about how to help the patients that were looking to me for help, and I didn't have the answer. So I began to realize that obesity is far more complicated than I ever thought. Every patient is an individual with a unique set of genetics, family dynamics, stress levels, etc. And appetite suppression is so much more complicated than I realized. So I have so much empathy for my patients and will really do anything I can to help them find solutions for their health struggles. So after troubleshooting with these select patients for a few months, I began to learn from obesity medicine specialists a bit about some of the medication options for reducing appetite and started to consider this right when I found out about plant-based keto. So being an ethical vegan, an animal-based keto diet would never be in the cards for me. Additionally, with all the research we have in nutrition, regardless of the nuances and macronutrient ratios, one thing we know for sure is the more plants we eat and the less animal products and processed foods, the more healthful of a diet and the more we can prevent chronic disease. So I started to think, okay, was plant-based keto actually possible? So I did a 2-week vegan keto experiment, which, by the way, I discuss extensively on the podcast episode with Spencer Nadolsky, if you haven't listened to that one yet. And I did this experiment to find out the answer to many of my questions about it. I wanted to know, is plant-based keto possible? Yes, it's not only possible, but it was actually quite pleasant. Does ketosis really work for appetite suppression? Well, for me during my experiment, it did. It was insanely hard to maintain calories and it really suppressed my appetite. Well, what about saturated fat? Wouldn't a plant-based keto diet still be high in saturated fat and cause my LDL to go up? Well, the answer is no. A plant-based keto diet isn't high in saturated fat at all. It was high in monounsaturated and polyunsaturated fats, which have been shown to be beneficial from a cardiovascular standpoint. I even checked my lipids pre and post, and they didn't change after 2 weeks. Well, what about fiber? Everyone says a keto diet is low in fiber. Well, it turned out my plant-based keto diet was incredibly high in fiber because all you're eating is plants. So it didn't change from my baseline standard plant-based diet, which I usually consume about 80 grams of fiber a day. So I began to realize and learn through my own experience that all the concerns I had about the keto diet actually didn't apply to plant-based keto at all. Saturated fat, fiber, animal products didn't apply to a vegan keto diet at all. So as I continued to deep dive in the literature, I spent a lot of time bugging cardiologists and scientists and obesity medicine specialists with viewpoints vastly different than mine, so I could learn from them. And I've learned a lot. What's come out of it the last few months is that I have an entirely new respect for obesity medicine. I realized that although I thought I knew everything there was to know about nutrition, I actually know a lot less than I thought. And this has been a really good thing, because it's fueled me to learn more. I no longer take an individual's interpretation of research as fact anymore, just because they're in my camp. And so I've appreciated the collaboration and learning over the last several months from scientists and physicians with totally different viewpoints than me. I have to say many thanks to Ethan Weiss and Carrie Diulus, who are on the podcast today. They've really been a huge part of me learning a lot about plant-based keto. But also Nicola Guess, Yoni Friedhoff, Spencer Nadolsky, Kevin Klatt, Kevin Bass, who've all shared tons of literature and data with me, which has greatly broadened my knowledge of nutrition. And my friends who are plant-based physicians like Rob Osfeld, Michelle McMack, and Mauricio Gonzalez and Garth Davis, they've really taught me more than any textbook. So bottom line is, I think regardless of the macronutrient profile you find that works for you, research has absolutely demonstrated that eating more plants and eliminating or limiting animal products is most helpful. And I think that plant-based keto has some potential. So even if it's not for you and you're listening to this, just be open-minded that it may be for someone. It may help someone else that's really struggling. So we're going to dive right into that this episode. Today's episode features Dr. Weiss, who's an associate professor of medicine at the University of California, San Francisco, and principal investigator in the Cardiovascular Research Institute. He received his MD from Johns Hopkins University School of Medicine, where he also completed his internship and residency. He came to UCSF in 1998 to complete his cardiology fellowship and research training. Dr. Weiss' clinical interests include prevention, lipids, and the emerging intersection of endocrinology and cardiology, with a specific focus on prediabetes and type 2 diabetes as risk factors for coronary disease. His research interests are focused on understanding the mechanisms of metabolic disorders such as obesity, fatty liver disease, and diabetes, including the role of growth hormone signaling and lipid metabolism. He also has an active program in clinical nutrition. He's served as the principal investigator on grants funded by the National Heart, Lung, Blood Institute, the National Institute of Diabetes, Digestive and Kidney Diseases, and he serves on the scientific advisory boards for multiple companies focused on using technology to favorably impact human health. Lastly, he's a recent co-founder of Keto, a San Francisco-based company aiming to enable the use of a heart-healthy ketogenic diet for weight loss. Dr. Carrie Diulus is a board-certified orthopedic spine surgeon, previously trained as a pathologist. She's a thriving type 1 diabetic and distance runner. She was morbidly obese when she started medical school and has done extensive personal dietary experimentation, most of her life being plant-based, to lose and maintain that weight loss. She previously worked at the Cleveland Clinic, but is now in private practice at the Crystal Clinic in Akron, Ohio. She is leading the charge to bring dietary strategies to the forefront in prevention and treatment of musculoskeletal and spinal conditions related to metabolic syndrome. So I'm so excited to have you both on today. Hey, guys.
Hey, Danielle.
Hi, Danielle.
So, all right. Well, who wants to start and talk about your story and how you got into, being interested? Both of you are in ketosis right now, I'm sure. I'm the only one on the podcast that isn't. So why don't you guys just kind of give a roundabout sort of idea?
Wow, how I got to plant-based keto. It's a long story, but I'll give you the Cliff Notes version. I first gave up meat and all animal products when I was 12. I was starting to put on some weight, and I honestly just didn't like meat. And we grew up in an area where we were surrounded by farms and cows and pigs and the whole thing. But honestly, I just didn't like meat. And I didn't want to gain weight. And yet I still gained a lot of weight in college. And that's a whole separate story in and of itself. But in my journey to lose the weight, I sort of did the original thing that was recommended, which was calorie restricted, low fat. I exercised a lot. I actually ended up on the national team for duathlon at one point because I was running and cycling so much. But I did a pathology residency and then switched and did orthopedics. And throughout that, was sort of maintaining the weight loss was its own journey. And most of the way I re-lost the weight after having my kids was, again, plant-based and calorie restricted, very low fat. But I started having problems with it. I was gaining weight. My hair wasn't great. My skin was having problems. And, everybody that I sort of went to in the plant-based community said, well, you must be doing something wrong. And, at that point, I felt like I could win an Olympic competition in calorie counting. So it wasn't working. And then, lo and behold, I got diagnosed as an adult with type 1 diabetes, which was funny because I was actually out, speaking at that time on how we utilize different dietary strategies to impact our orthopedic patients' metabolic health. And I was like, this can't possibly be true. So at that point, I followed initially the diet that was recommended, when you go on insulin, which is that you have a certain number of grams of carbs per meal. You balance that with the insulin that you give. And, I would vary in blood sugar anywhere between 40 and 400 in a day. And I was, busy spine surgeon at the time. And I really quickly realized that, despite having an undergrad in biochemistry and all the other training that I did, I just couldn't figure out how to appropriately give insulin, for an apple so that I wasn't bouncing all over the place and having to watch my blood sugars all the time. So I just ended up getting rid of most of the carbohydrates. And at that point, I started what was more a traditional ketogenic type diet because that was all that I really knew was available. And it evolved over time. So long story, but I got sick and I ended up switching to plant-based keto, which I didn't think was possible to do. And I had some reasons for doing that. And after 6 months of being entirely plant-based keto, a lot of the labs that I had sort of been struggling with, like my high sensitivity CRP and some things in my lipid profile, all became perfect. My insulin requirements stayed as low as they did when I was on keto, and my blood sugars were really easy to keep in a safe range. And so for me, I haven't looked back yet. Now, I've always said if I have any objective reason to consider adding any animal protein back, I will. But at this point, it's been, more than several years that I've been entirely plant-based keto, and it just works well for me.
That's awesome. You were actually the first person that kind of taught me even what it was at all. I didn't think it was possible until I met you. So it was super. And if for anyone listening that you've obviously know that I did a 2-week vegan keto experiment, and Carrie was checking my urine strips for me like BID. So she knows me intimately well, knows exactly how many. I guess I don't even know what it tests, what it actually tests for.
So yeah, and Ethan can speak to this too. So there's 3 different ways to test to see if you're in ketosis. One is with urine, which tests acetoacetate. The other is blood, which tests beta hydroxybutyrate. And then the third way is breath, which tests acetone.
Gotcha. So Carrie helped me completely through my 2-week vegan keto experiment and told me what to eat, what to do. And yeah, so thanks, Carrie. All right, Ethan, you're up. Tell everyone a little bit about you. I read your formal bio, but a little bit about you and your interest in metabolism and kind of, in cardiology and why you're in ketosis and all that.
Okay, I'm going to try and keep this quick because the story can be long and boring and no one needs to hear it. So, I came out to California 21 years ago to train in cardiology, and I went to work in a lab. And at the time I was studying how blood clotted because it was kind of important or we thought it was important in how people had heart attacks. And lo and behold, fast forward, 10 years later, we're doing this experiment, and the experiment, we set out to try and understand something related to blood clotting. And we ended up making a genetically modified animal. And I know no one around here loves animal testing, so I'll keep this really quick, but this animal developed really super fatty liver. And so that sort of launched me into this interest in metabolism. And from there, I got very interested in nutrition and in human nutrition and human metabolism, and have spent the last kind of 10 years of my career learning a second field. And it's very daunting and hard to do that, but I've enjoyed it. And personally, I got interested in this I guess it started off by, I was asked to advise a couple of companies who were using various nutrition interventions to try and help people with metabolic disease, with obesity, type 2 diabetes. And honestly, the first time I heard about the keto diet, I thought it was kind of creepy and maybe cultish and weird, and was not into it at all, and really didn't try it on my own until almost 2 years ago. And that was sort of an accident, and I can tell you that story later, but that's how I got into it. And I'll just say this, at the time, I was certainly not obese, but middle-aged guy who was sort of 2 kids and working hard, had definitely gotten soft. And this was like a revelation for me. And I felt like, and continue to feel like I did when I was 17.
It's interesting. I do want to preface also for everyone listening, because as you guys both know, because I've told you, in the plant-based community, there is a belief that we are supposed to be eating these low-fat, whole food plant-based diets, which I previously also believed. And I think it works for many, many, many patients. And so I just want to preface this entire podcast episode with the fact that I have no financial incentive to recommend ketosis, a keto diet for anyone. I just want everyone listening to know that, unlike a lot of people in the nutrition space, I am not currently hawking anything for you guys to buy, and my interest in plant-based keto is genuine. I think, Carrie, you can speak to how confusing it can be, because for anyone listening, the whole idea about adding fat to your plant-based diet seems very foreign.
Yeah. Here's the thing. I've been doing this for a number of years and sort of posting it out there so that people can see what I do, for it to be an option. And it's amazing how much pushback I get from both the plant-based community and the low carb community. And it's for different reasons, but it's fine. I have enough friends in my life that I don't need any more.
I'll be your friend, Carrie.
Thanks. But so, people think that you can't do it. So the low carb people think that you can't get enough protein if you're eating a plant-based low carb diet. And honestly, there are a lot of options, and we can talk about those in a second. From the fat standpoint, for me, it was a matter of, there's 3 macronutrients: fat, protein, and sugar, and carbohydrate. And if you're limiting one of those, you have to increase one or the other. And for me, I found through experimentation what my optimal amount of protein per day is if I'm going to maintain. I work really hard, long hours, and I also run a lot. Like, I found what amount of protein I need to sort of maintain my body composition. And then the fat, the things that I added in from a fat standpoint are avocados, nuts and seeds. I do use some olive oil, olives, chia seeds, flax seeds, things like those, which for the most part are whole, real foods. So, what my day may look like, what a meal for me may look like, is there are these beans called lupini beans that have 0 net carbs. They have a ton of fiber, or I can use black soybeans or tofu or hemp or some other things like that. I also have celiac, so I can't use the things that have gluten in them because I won the genetic lottery that way. So, I'll have those as my primary protein source. And then I'll have a bunch of leafy green vegetables. I'll have salad with some olive oil on it. I'll put some nuts and seeds on it. I eat a ton of broccoli and asparagus and cauliflower, and, put guacamole on everything, and hot sauce, because everything is better with hot sauce and nutritional yeast. So, my diet, it's pretty simple. It's pretty straightforward. It's mostly whole food. Some people argue whether olive oil is a whole food or not, but
we're not going to do that today. I've done the olive oil battle far too many times.
Right. And at the end of the day, every single one of my modifiable markers improved to the optimal range. So, for me and for many of my patients, this is a way that's sustainable. And, I have no objective reason to think that there are downsides. And my A1C, which is a measure of my blood sugar control, varies between, 4.7 and 5.3, which is almost unheard of. The goal for a type 1 diabetic is 6.5 to 7.
I mean, that's amazing. I totally agree with you. When I went into my vegan keto experiment, I will be fully honest and full disclosure. I was very anti keto diet, like forever, very anti. I like you and I like Ethan, but I was very much like very not. I was hoping it was going to fail. I was going to do 2 weeks. I was like, this is going to blow up my LDL. And then over that span of time in July, I was like, wait a second. I started to actually read the data, read more about polyunsaturated fatty acids, read about what actually talk to different lipidologists. And everyone's like, your lipid profile probably won't change at all. And it didn't. If anything, it even mildly improved with zero statistical significance, but there was just some tiny improvements. And so I think that the idea that it can be helpful is actually very clear to me now. I have no hesitation in prescribing it for my patients. And I think it's a very interesting, way to eat and have the benefits. So the first things I wanted to start out with you guys, just some of the basics. You guys can go into how do you go into ketosis and how you maintain staying in ketosis, just kind of like the basics of going into keto, and then we'll get more from there.
Before we do that, Danielle, can I just say that I want to thank you for doing what you did, because it was pretty brave and unusual. I think we're all aware of this ridiculous diet war, nutrition war thing that happens out there that's frankly just annoying as hell. And it was great to see you try this and admit that you went into it with not such an open mind, and then admit that you actually had a better experience than you thought you were. And I think the product of that has been tremendous. I mean, first of all, it's brought the three of us together in a way that none of us expected, and it's been fun. And we'll talk about all that later, but it was really awesome that you did it. I know that Carrie's like, wait, I've been talking about this for 5 years, and all of a sudden Danielle opens her mouth and like the whole world talking about vegan keto.
Thank you. I think it's, for me, I think that I've just been, I'm telling you, for over the past 2 years, I've realized how complex obesity is. And I'm sure you guys can kind of speak to how it kind of explains, because I don't even understand how ketones suppress appetite. But for anyone listening, it works. I mean, and maybe it doesn't work for everyone. I'm not going to say that everything works for everyone, but for me, I personally had to stop my last vegan keto cycle because I thought I was going to lose too much weight. I'm never hungry when I'm in ketosis. So I think it is a really, really great, and I think that it's something that once you experience it, you can't unknow it. It's a really interesting experience. And I think it works for people that want to try it. So most people have been asking me kind of the basics. If you could just kind of describe, how do you go into ketosis, and the whole, there's like a lot of myths about how you can't have any carbs, where I kind of dispelled that. I was having 100 grams of carbohydrates a day on my experiment, but
yours was mostly fiber.
Yep, 80 grams of fiber. Yeah. So if you guys could start from the basics.
Sure. So the one thing I do want to say about satiety too is it is significant when you're in ketosis that, I used to think you had to be a special kind of stupid to miss a meal, because all I could think about was wanting to eat all the time. And when I'm in ketosis, which is now most of the time, I have to remind myself to eat. Like I'll operate all day and then not eat until I get home.
So is that from I have actually not looked into this. Is there something about the ketones that actually suppress, what is the actual mechanism of that?
Yeah. I mean, maybe Ethan, you can talk more about this, but there's some different theories on it. I don't know that anybody fully understands how it impacts the different hunger hormones. I think there's sort of a theory behind it that, if food was in scarcity and we were hungry all the time, we would not, we're a communal species and we would not get along very well if we got, we're perpetually angry until we found food. But I don't think anybody fully understands the mechanisms, how it impacts the hunger hormones specifically, but those questions are being asked.
Yeah, I mean, there have been, if you start at the beginning, there have been randomized controlled trials to look at appetite and satiety and every other measure of hunger, absence of hunger. And I think there's no doubt that on a proper ketogenic diet that hunger is reduced versus other diets. I think people believe that. I don't think we understand the mechanism. And I think, as Carrie alluded, there are lots of studies looking at potentially the role of ghrelin or other hormones that affect appetite. I mean, my personal favorite theory is that it has something to do with insulin, but I'm sure that's not all of it. And to be, just to circle back to your question before about whether or not it's ketones itself or it's carbohydrate restriction or it's something else, we don't know. It could be any of them or all of them.
That's interesting. I know it's a definite difference. And I think, not to say that nutrition has to be so individualized, but I do think that on some level it is, because I think there are some people who can eat, and I normally do. I eat normally my regular diet is like a gazillion grams of carbohydrates a day and I'm fine, but I am kind of always hungry. I've never experienced the feeling of being like not hungry at all until I was in ketosis. Like I've never felt like that. It was shocking.
I think that's the most common thing that I hear from people who start it for the first time is that they feel like they're never hungry. And, some people think it's just you're eating all this fat, and fat is very satiating. And again, there are like 150 theories and it needs to be worked out why, but I think it's pretty clear that there's definitely a difference.
I mean, and I don't think it's the fat that you're eating because like I said, I can have my last meal at 6:00 at night and I can go until 6:00 the next night and have operated the whole day. It's not like I'm drinking butter for breakfast and that's the reason why I'm not hungry. I just am not eating. So, it kind of goes into the question that you wanted us to actually start to talk about. And then we kept getting off on tangents, which is, how do you get into ketosis? There are a number of different ways to get into ketosis. Fasting is probably the single fastest way to get into ketosis. And there's some, things that people need to be cognizant of trying that. But ketosis in and of a ketogenic diet effectively could be just fasting.
Right. Fasting's the original.
Fasting's the original keto diet. And then there are some calorie restricted, like very calorie restricted ways to get into ketosis where you're limiting protein. Walter Longo talks a lot about this with the fasting mimicking diet. And again, it's a way to mimic fasting. And then the more traditional ketogenic diet, which typically is moderate in protein, it's higher in fat. And again, as we've talked about with, plant-based, it does not have to be animal-based fats, and then low in carbohydrates. And depending on how metabolically healthy you are, people may have different tolerances for the amount of carbohydrate that they can tolerate or how much they exercise. But in general, we recommend about 20 grams of net carbs per day. Some people, it's too hard to figure out what net carbs are. So we'll keep it simple and say, 30 grams of carbs per day total.
Unless you're having 80 grams fiber, then it's 100 grams total of carbohydrates.
Right. Again, that's if somebody has a hard time with that. I mean, patients all come with different sort of abilities to, follow prescriptions regardless of what we do. So, we do have to keep that in mind and tailor it to the individual. But in general, what we recommend is, keep net carbs below 20 grams. And so for me, I look at those as insulin impact carbs. So if I eat, on any given day, a simple day where I'm not trying to get extra fiber, I'll easily have 75 grams of carbohydrate, but 50 to 55 of those will be fiber. And in general, fiber itself, now there's soluble fiber and insoluble fiber, and we could get into the nuance of those different things, but in general, fiber itself doesn't need insulin for it. And so it's those impact carbs that need insulin. And as a type 1 diabetic, carbs sort of can't hide from us. We have to give insulin for carbohydrate. So that's the basic way of getting into ketosis. And it can take, depending on, you got into ketosis really, really fast.
I normally do. I wanted to touch on that with regards to, like you were saying, with transitioning into ketosis, because so I've done fasts before and I felt terrible. So I've done a 5-day water fast before and I felt horrible, like I was going to die. And it's because when I didn't realize that I was obviously going into ketosis and wasn't repleting my electrolytes at all. And then this time when I went into ketosis to do my 2-week keto experiment, you gave me some simple advice, which was just to get some sodium and magnesium in, and I felt great.
Yeah. So when you go into ketosis, there's a shift as you burn through the muscle glycogen that is stored. There'll be a osmotic shift of water out of the cells. So, that's often one of the things that people notice first is they feel like they lose weight in their hands and their face. And some of that is the fluid shift. And when you shift off fluid, you lose sodium along with it. And then that sort of can drag potassium and magnesium along with it. So one of the ways to mitigate the sort of keto flu people will talk about is to have, 2 to 5 grams of sodium per day and then take a magnesium supplement to, help stave off those symptoms.
And not to interrupt you, but Ethan, can you speak to everyone hearing this is going to have a heart attack hearing to tape people? We should be ingesting more sodium because everyone in cardiology is saying that we should be limiting sodium. Can you kind of touch on why when you're in ketosis, it's not the same?
Well, I mean, we could do an entire podcast on this. So I think there's very little evidence to support this ridiculous sodium restriction that we have sort of in the diet or nutrition recommendations or guidelines. But certainly for a week in somebody who doesn't have uncontrolled hypertension or heart failure, there's little to zero risk in augmenting your sodium intake. It's really not a big deal at all. And as Carrie says, you will feel a lot better. You'll feel normal if you do that. It's probably the biggest reason why people feel lousy when they go into ketosis. So there's definitely not anything that I know of in terms of danger. Now, I would recommend that anybody who's going to try this, especially if you have a chronic disease,
or you're on medication,
heart failure. Yeah. If you're on any medication, especially some of these new diabetes medications, that you want to do this in, close collaboration with your doctor, because there are some things that can come up that are complicated.
And any type 1s that try, we published a paper on it with Belinda Leonardson, David Ludwig last year, but it is a whole different method of insulin management. And you have to be careful, not to use the amount of insulin that you used to be using, because you will need so much less.
Absolutely. Everyone, anytime anyone does any sort of diet change, I always recommend everyone does this in conjunction with their physician, their NP, their primary care provider, whoever they're working with. Okay, great. Well, that was an excellent, easy explanation on how to get into ketosis. You just need to limit to 20 net carbs a day, which is total carbohydrates minus fiber, and then replete sodium, magnesium, and you should avoid the keto flu. I definitely did this time for sure. So I really just want you guys to hit home on the first topic that everyone is so passionate about when it comes to keto in general. So Ethan, you are someone that studies metabolism. You've kind of enlightened me to just how confusing metabolism is and how much I thought I knew a lot. And then I realized I know nothing, because it's so much more complex than I gave it respect. So can you kind of explain how going into ketosis, especially, and being on a keto diet, especially if you're on a plant-based keto diet, how this does not really change insulin resistance?
If you ask a high carb, low fat nutrition advocate about the effects of the ketogenic diet on metabolism, they'll tell you it causes insulin resistance. If you ask somebody in the sort of low carb, high fat ketogenic nutrition world what it does to insulin sensitivity, they'll say it augments insulin sensitivity. So somebody's wrong. And I think it's probably just a difference in the way people are thinking about things. I think there's a lot of evidence from animal models and other sort of well done metabolism studies that are done on the inpatient ward and metabolic wards. The effect is probably positive in terms of insulin sensitivity, but I think there's a lot of questions and debate about what that word even means, insulin sensitivity or insulin resistance. So I try not to get too bogged down in it. I think what Carrie said earlier about somebody with type 1 diabetes, and the same thing goes for somebody with type 2 diabetes who takes insulin, that the amount of insulin they take will go down. I think that to me is pretty telling.
I mean, here's the thing I can tell you, Danielle, is my insulin to carb ratio went down significantly compared to when I was eating following the original ADA guidelines. So insulin will drop, a small amount of insulin will drop my blood sugar almost tenfold what it used to when I was doing the more standard recommendations. And I microdose insulin now rather than for this carbohydrates compared to what I did before.
Danielle, I think part of the confusion is that glucose tolerance will go down in people who are keto adapted and have been on the ketogenic diet for a period of time. And I think we sort of understand why that is. And we also, Carrie and I love to talk about some of the reasons why we think, but glucose tolerance is different than insulin sensitivity. So if you injected somebody,
can you actually really elaborate on
that? I mean,
that?
it's very simple, right? I mean, if you did what was considered, the old days, we don't do it anymore because it's too dangerous, but we used to do this test called an insulin tolerance test, where you would take somebody and inject them with insulin, and then you'd measure what would happen to their glucose. If you did that test in somebody who was keto adapted versus somebody who's been eating a high carb diet, you will see a much greater relative reduction in glucose for the same amount of insulin. And to me, that's a sort of whole body insulin sensitivity. That's a measure of whole body insulin sensitivity. Glucose tolerance is different. That's giving somebody a load of glucose, usually orally, but it could be done IV as well. And then you measure what happens to sort of how well they tolerate, what happens to the levels of glucose over time. And if you want to get fancy, you can measure what happens to insulin as well. So somebody who's keto adapted is going to have very abnormal glucose tolerance, at least for a few days. And Carrie can explain why that is. But I think it's pretty clear that you'll have improved insulin sensitivity, that whole body insulin sensitivity that is response to the same amount of insulin. At least that's my experience. And that's my understanding of the literature. Carrie, I don't know if you have a...
Yeah, I mean, effectively, everything that we understand is the body will metabolize available fuel. And so when glucose is your primary fuel, the cells are going to upregulate the enzymes in order to be able to metabolize that fuel. When fat becomes the predominant fuel, they'll downregulate the enzymes that are necessary for glucose metabolism because the body doesn't want to, you have to keep the blood glucose within a safe range. And so the body's going to work to preserve that level of glucose because there are certain tissues in the body that, red blood cells, for example, are glucose obligate cells. It was originally thought that there were certain cells within the brain that needed glucose only, although most of the cells of the brain can function with ketone bodies. But now it looks like even the cells that they thought needed glucose can function with ketones. So for the most part, the body wants to protect this safe glucose range so that you don't become hypoglycemic because hypoglycemia can lead to death. And so the body will downregulate the utilization of glucose and will upregulate the metabolism of fat. I can tell you if I go for a long run and I measure my breath acetone after that, it goes up really high because my body, I can actually even shut my insulin pump off and keep my blood sugar in a stable range and directly measure that I'm burning fat during that run with that. So it takes about 3 days on average for somebody then to shift back over to being somebody who can effectively burn carbohydrates. Now, the caveat to that is somebody who's really physically fit and metabolically healthy, like what we saw with you, you can get into ketosis very quickly. You can get out of ketosis very quickly and be perfectly healthy. Whereas someone who has, some more metabolic dysregulation, it may take them a little bit longer. The average is about 3 days is what, the data seems to show.
Interesting. So when it comes to the data, I've been bugging you both about this, and I've been trying to read and understand. I know that Ethan, you've done a lot of research with Dr. Shulman, and when I tried to understand insulin sensitivity or insulin resistance and tried to kind of figure out the etiology, he actually has in one of his lectures a great schematic of like all the different things and ideas like ceramides and whether it's saturated fat or whatever.
I think this comes back to what we said before, which is you have to define what insulin sensitivity means. So in the laboratory, you can talk about insulin sensitivity in a whole body way. That is sort of like I said, if you give a dose of insulin and you measure what the effect is on glucose, that's one way of measuring whole body insulin sensitivity. That's a complicated, integrated physiological response. And so it's not perfect, but obviously every cell and tissue that responds to insulin in the body responds differently. And there are times where you have what's called selective insulin resistance, where one cell or tissue will respond and one won't. And the classic example of that is hepatic insulin resistance. I mean, there are times where the liver is quote unquote resistant to the actions of insulin. And this has led to like a tremendous and long heated debate and battle among many people in the field, including Jerry and some of his proteges and colleagues, about whether the liver even responds to insulin directly when in terms of its effects on turning off glucose production, what we call endogenous glucose production. There's a debate about whether that happens directly or indirectly. That is that some people think that it's actually insulin action in other cells, like fat cells, that controls the response that you see in the liver. So it's a very messy field. And I think it gets frustrating because people don't exactly know what they're talking about when they're even defining insulin sensitivity as a thing. And I'm not even sure it really is a thing. I think I'd prefer to talk about it at the individual and cell and tissue level, if at all possible.
Everybody tries to sort of oversimplify it to make it understandable. And the reality of it is it's incredibly nuanced. And to Ethan's point, it's different in different tissues. And at the end of the day, the thing that matters the most is connecting with patients and giving them something where they can be successful. So I think while it's great for us to study and learn all of this nuance behind it, we also need, in the meantime, to take care of human beings.
Very true.
So there's a difference between physiologic insulin sparing and pathologic insulin resistance. And that, goes along with type 2 diabetes, which the issue with type 2 diabetes is overnutrition of both fat and sugar together. And a lot of the studies that looked at insulin sensitivity when, especially the mouse studies or the rodent studies where they called it a high fat diet, it was actually high fat and high carb together. And that is a problematic combination and, led to a lot of the belief on problems with insulin sensitivity. But I mean, I can tell you from my own personal experience again, and a lot of type 1 diabetics that, we find that we're so much more insulin sensitive, meaning in our definition of it, we utilize not only less total daily insulin, which makes sense because you're eating lower carbohydrates, but that for any gram of carbohydrate that we eat, we need less insulin than we used to in the past. Now, if you eat a lot, if you overconsume calories,
right. It doesn't matter what it is, whether you're on a keto diet and you're over consuming fat calories, or whether you're on a low fat plant-based diet and a high carb diet and consuming extra calories of lentils. It doesn't matter either way if you're over consuming calories.
Right. So those type 1 diabetics that are eating massive amounts of fat, well above what their caloric requirement would be, they definitely are reporting insulin resistance with that. But I don't think that that's any different than the person, with metabolic syndrome who is over consuming fat and or carbohydrate along with it.
People will say, like, you have to have insulin resistance to develop type 2 diabetes, that it's a precursor to developing type 2 diabetes. I think that's probably largely true. I think that according to what Carrie just said, that basically the definition, if you want to use a definition, that you're disposing of less glucose per unit of insulin. You're going to, the ability of insulin to do what it's supposed to do at the cellular level is reduced. That to me is insulin resistance. So you can see that clinically by having to increase your insulin dose if you're using insulin. And if you want to be really specific about it, you have to increase your insulin dose on a per gram of carbohydrate basis. So if you want to, be like, if we wanted to define it, we define it as that. But I think the truth is what we see is people are actually having benefits. I mean, they're having tremendous benefits across the board clinically. And I'm not sure where the whole narrative of this insulin resistance thing came from. I think where people are confused is that people have glucose intolerance, which is a totally different animal and can be explained, I think, and is transient and goes away after a couple of days. And I think Carrie did a good job explaining why we have that. It's a protective mechanism. I would say skeptical keto people out there in the nutrition world, somebody like Kevin Hall, even Kevin Hall would say that carbohydrate restriction, low carb, high fat diets, ketogenic diets have the most promise in treating patients with type 2 diabetes. I think that to me is pretty well accepted in a general nutrition world.
And, the ADA, it's one of the recommendations now. And I can tell you, even in my orthopedic practice, I am getting type 2 diabetic patients off of insulin just by helping them with this diet. And I'm an orthopod.
Can we now talk about how a plant-based or plant-predominant keto diet can be healthful from a cardiovascular standpoint, and you don't need to worry as much about your lipids going crazy as much as you would with maybe a standard keto diet, which would be high in animal products?
Okay, let me tell you a little bit of the story. So I alluded earlier that I started this low carb diet thing kind of by accident, and I had this amazing response. I definitely felt less hungry. I lost all this weight. All of my blood markers improved pretty dramatically. I literally had to go out and buy new clothes. I had people think that I had cancer. So my dad is a cardiologist. So I grew up in the 1970s and 80s at a time when the cardiology world, and I think the mainstream medical world in general, thought that fat was terrible. All forms of fat. There was really no distinction between monounsaturated, polyunsaturated, or saturated fat. It was just fat was bad. And so as a kid, we had no fat in our home. We had unlimited carbohydrates in the form of refined carbs, even Coca-Cola and Doritos and stuff. But you could not find fat. We had egg beaters and we had margarine and anything you could think of that looked like no fat. And I think the reason for that was that there was this movement that thought that fat was bad. And the main reason was that it seemed to elevate LDL cholesterol or bad cholesterol. And so when I first heard about the Atkins diet in early 2000s, I also was worried about it from the standpoint of cardiovascular risk. And when I came back to it a few years ago, I also was worried about it. I was somewhat reassured by the data that I saw coming out of places like Virta and other trials that I'd seen where it looked like the effects on lipids were modest. It did look like there was a reproducible but small increase in LDL cholesterol. But if you looked deeper, there wasn't a change in ApoB. There was no change in LDL particle number. And it looked like the effect, at least in these trials, was relatively modest. But it was still kind of worrisome. And because I grew up in that era where fat was bad, I had a hard time accepting eating all that fat. And so as I learned more, I learned that there were people who had this tremendous response in terms of their LDL cholesterol going up when they went on a ketogenic diet. And as a result of that, there's a group of people out there who have now come to believe that that doesn't matter And so that has occupied a good part of my life for the past couple of years, trying to understand this and to talk about this and think about it. And I guess ultimately I came back to this principle that I think you can't go away from, which is that until we have proof that LDL cholesterol is not dangerous, I think we have to assume that it is, no matter how it goes up. There are absolutely reasons to believe that increases in LDL cholesterol as a result of nutrition changes may be less dangerous than if they were high because of genetics or other reasons. But I think that's not the default answer. We have to assume that that's not true until we can prove that it is. And so in the meantime, what do we do? So it turns out that a lot of sort of nutrition replacement studies where people will actually replace one macronutrient with another, either say replace a carbohydrate with a fat or replace different kinds of fats, they all seem to suggest that the increase in LDL cholesterol in people who go on these diets is most likely mediated by this relative increase in saturated fats, and particularly animal-based saturated fats. And so that has gotten me very interested and sort of led to this change in the way that I think about ketogenic diets from the conventional ketogenic diets that I think do, not in everybody, but in some people, lead to what I see as being very dangerous and significant elevations in LDL cholesterol. I think, we have evolved in our understanding of the role of dietary fat from being something that, again, back in the 1980s was, even as late as the mid-1990s, was viewed as being universally dangerous. I think most people, and maybe not everybody listening to this podcast, and maybe the majority of people listening to this podcast won't agree with this, but I think most people now accept that not all fat is bad. And in fact, some fats are not only not bad, but they're healthy. And I think you can point to certain nutrition studies like Leon Hart or Predimed. And I think most of us now believe strongly that monounsaturated fats in the form of things like olive oil, avocado, nuts, and some polyunsaturated fats, especially omega-3 based fats, like the kind you find in fish or algae or flax. I think those are pretty widely now believed to be not just not dangerous, but healthy. And again, they have, I would say, either neutral or in some cases positive effects on lipids if you're looking at markers.
Just to Ethan's point about omega-3s, I can't speak to the cardiovascular literature on that, but I can tell you that there is mounting data in the orthopedic, musculoskeletal, and neurologic. There's strong evidence that people need to have a certain level of omega-3 either in their diet or supplementation. And in fact, in stroke patients, in traumatic brain injury patients, and for anti-inflammatory purposes, we're utilizing omega-3s to help with those conditions. So there are essential fats that we need to have. From the standpoint of LDL, I don't want to give a bunch of anecdotal data, and be sort of lumped in with the group that makes unfounded statements. But
I'm here for this. Give it to us. I'm ready for your anecdote.
Yeah. The anecdotal things, there's a vegan keto, it's called Vegan Keto Made Simple Facebook group with like 50,000 people in it at this point. And at one point we asked everybody to sort of show, what happened with their lipids. And I can tell you it was the same in my case. And I know other people who did standard keto who then shifted to, increase their polyunsaturated fats and their monounsaturated fats, and LDL drops significantly. There's
a study that shows that polyunsaturated fat may actually decrease the aggregation of the LDL particles, like once inside the endothelium, and, decrease aggregation susceptibility, which makes decreased risk of atherosclerosis. So there seems to be, even from a mechanistic standpoint, reasons why higher amounts of omega-3s and things like that would be cardioprotective.
Yeah. Again, if you look at it, you can look at the epidemiology, you can look at you can pick any study you want. And again, part of the problem I think in nutrition is because you can find a study that supports whatever pet hypothesis you have, that there's a lot of this arguing and comparing studies. But I do think the bulk of the data does lend support to the idea that especially intake of omega-3 fatty acids in the diet seems to be protective. And then you don't even get in, then we get into the whole, recent thing. I think we're at a point now where we can at least set aside this idea that it's dangerous. And I think there's a lot of evidence to support that it's probably beneficial. I'm sure there are going to be people who disagree with that. And those people are free to disagree with whatever they want.
Right.
But that's the sort of basis for how we've been thinking about nutrition. And again, it's based on this idea that we want to design a nutrition program that's as optimally healthy from a cardiovascular standpoint as we can. And so, we've taken the approach of looking through everything we can look through, trying to be relatively unbiased or as unbiased as we can. And that's led us to, in my, thinking, believe that a standard conventional low carbohydrate, high fat ketogenic diet is not for everybody. And I worry about people who go and eat a tremendous amount of saturated fat from animal-based sources. I think over the long term, that would make me very nervous.
I totally agree. I second that. I do think that from coming from a space, and everyone listening who is like quite scared of fat, that just like Ethan alluded to, there's a good point that we can kind of find data that'll support any narrative we want. I have no bias here. And so I've like been driving myself nuts, trying to deep dive into this, asking everyone possible and reading as much as I can. I just like cannot find any data to show that polyunsaturated and monounsaturated fat is anything but either, like you said, neutral or cardiovascularly beneficial. I can't find anything for the opposite.
Yeah. I mean, well, there you go. So
yeah,
somebody else will. It doesn't mean that we won't find that somebody else won't find it, but I think you're right. Right now, that's at least my take and my read of the literature.
Yeah. And Danielle, again, I just spoke at a conference this past weekend, and there was a study that came out that looked at nutritional supplements. And of course, fish oil comes under the category of those nutritional supplements, including I had never even heard of this before, but it's this avocado soybean, mixture that's a third avocado oil and 2/3 soybean oil. So they looked at this and they found that it actually could significantly reduce pain and inflammation in people with osteoarthritis. And that, was just that one area of it. But when we look at then omega-3s, actually, they sort of weakly recommended that one. But when they got to omega-3s and they looked at the bulk of the literature around omega-3s, particularly in like rheumatoid arthritis patients, what they found was ultimately the recommendation. So this was sort of like a Cochrane review. And it was 50% weak in favor, 50% strong in favor, which was the most favorable thing that they recommended as far as things that are supplements. And, what the literature shows is that omega-3s can decrease CRP, it can impact IL-6 positively, and it can impact things like tumor necrosis factor alpha. So, there are mechanisms where these fats have benefit, and they're polyunsaturated fats, right? So I get mine as an algae oil so that I supplement with it. People who eat fish obviously get it as fish oil.
So I've recently become obsessed with this as well. And so I've been like churning through flax because I feel like I was never concerned about my omega-3, omega-6 ratio. I'm still not sure if there's any true clinical relevance for this for me personally, since I don't eat a lot of omega-6s, but I definitely have been trying to like up my flax. And actually on a plant-based keto diet, you can actually get a ton of omega-3s. You can have chia, flax, walnuts. That's actually one of the major benefits of it. And that's why I wonder, I'm just hypothesizing, but for my patients that I started it that had so much improvement in their cholesterol, and even the two that had an improvement in their LP(a), which I can't figure out, I'm wondering if this does have something to do with the change in either with just the polyunsaturated fatty acids in general, or if it's about them eating high omega-3. I don't know. But there's so many benefits. I hadn't paid attention to that before.
And there are some people, just to talk about ALA versus EPA and DHA for just a second, but there are some people who genetically are not good converters of ALA into EPA and DHA, which are so ALA is the plant-based form. Algae oil does have EPA and DHA in it. And then as we get older, even those who are really good at converting it, there's some data to suggest that we sort of lose the ability to convert that. So, for sure, there are people who get all of the omega-3s that they need from flax and chia and things like that. Again, I like to err on the side of making sure that I'm getting enough of the EPA and DHA. So that's why I use algae oil.
Gotcha. Me too. I recommend everyone takes it baseline if you're going fully plant-based, just to be safe. So I guess what I wonder is then actually for Ethan, so since you switched to start a keto diet, did you go straight into this very like plant heavy keto diet right away? Were you on a standard keto diet first and then you kind of switched over, or have you always been on this sort of plan?
Yeah. Okay. So good question. So I think, my history is that when I moved to California, I stopped eating beef. I still ate fish and some poultry and occasionally, like other animals. But I would say I had a relatively low intake of animal products. When I started keto, I went whole hog. I mean, I didn't eat beef because I don't eat beef, but I did eat a lot of like bacon and other traditional like fatty animal-based foods. But I didn't like it. I just didn't feel good and I was nervous. Now, I measured my lipids after I'd been on this diet for a few months and they didn't change. So I'm sort of fortunate, I guess, that I didn't respond badly, but I was still bothered. And I was bothered by the fact that a lot of other people were having negative changes. And so I wanted to explore. I didn't really know how else you could do it. I think that's one of the things is that people think keto is just eating bacon, butter, and lard. And the truth is, like, I thought that, and it's not true. And I mean, I think everybody thought that because that's how it's portrayed. But I think what's clear is that there are other ways to do it. So we started to explore trying to lean heavier on plant-based sources of fat and also fish. Now, I understand that most of the listeners on your podcast are not going to eat fish for ethical reasons or other reasons. And so it was, my appreciation of doing an entirely plant-based keto diet really only came basically like a couple of months ago when you started talking about it, even though that I knew Carrie and I knew Carrie was doing it, but I don't think I was really paying attention. And frankly, I didn't really believe it until I tried it myself. And so, it is hard to compute where you're going to get all this. Well, Carrie and I have talked about this before. I think the two things that are mysterious are where you're going to get fat. I think you can begin to understand that you'll have plenty of plant-based sources of fat from things like olive oil, avocado oil, et cetera, et cetera. The other question was, how are you going to get all the protein? And that, I think, was the magic of sort of Carrie teaching.
We're supposed to limit our protein, right? Because of gluconeogenesis, everything like that. You're supposed to only have, when I was on it, you told me carry 60 grams of protein a day.
Yeah. I mean, it's a moderate amount of protein and you can easily get that from the plant-based sources.
But so your point is a good one, Danielle. In an average normal person who just doing a ketogenic diet for the first time and eating animal stuff, the biggest reason that they have trouble getting into ketosis, in my experience, is because they are eating too much protein, because they're afraid to eat too much fat. I bet in a plant-based keto diet that is not going to be a problem because it's harder to get protein. I think you'd have a very hard time overeating protein. I don't know, Carrie, do you think? I mean, I think you'd have to really work to overeat protein on a plant-based keto diet.
Absolutely.
And also, so you can also do it. I know that you can do it using olive oil, things like that. But this last time, for anyone listening that wants to do it without olive oil, you don't like it, or if you just are kind of habitualized to just not like it at all. I have been doing it lately, even just like with whole foods. So I just have been doing like a ton of chia, a ton of flax, and like a lot of nuts and avocado, of course, and just regular olives, and have had no problem. I think that plant-based keto, and I do have listeners, by the way, that are omnivores, or a pescatarian keto diet. I think that they're both, they seem like really impossible. And I think that I 100% thought it was impossible before. And I didn't even think it was a thing until I met Carrie. So it is interesting.
This whole experience of discovering keto for me was pretty powerful. And I think, there's a lot we could talk about, but I got into this sort of thinking about sort of it from a behavioral standpoint. I was very interested in sort of how we could change people's behaviors when it comes to nutrition and eating specifically, and improve their weight and metabolic health for people who were looking for such a thing. And what was interesting about the keto diet for me at the beginning is it's the only diet I know of that allows you to track a biomarker other than weight to know whether you're doing it correctly. That is that because of what happens that Carrie described earlier, that when you restrict carbohydrates and increase your fat intake, you're going to start making ketones. Your liver is going to start churning out this alternative fuel source. It's something that you can use as a way to sort of understand if you're doing this thing correctly. And then it can become a behavioral reinforcement tool. So we initially, when we launched this company that's called Keto, we started off by making what's effectively like a breathalyzer for acetone, which is a ketone. And what that does is provide people with feedback as to how they're doing. And I think that's very helpful, especially at the beginning, in guiding this behavior change. And so that was the sort of crux of the business. And when we started, we were agnostic to the different kinds of keto. To us, there was just one kind of keto. Again, as I've told you, over the past year and a half, I've started to understand a lot more that there's not just one way to do keto. And so part of what we've been doing at this company is to reimagine keto. As we said, sometimes we'll call it Keto 2.0, a keto diet that's not going to be based in the traditional animal-based saturated fats like, bacon, butter, and lard. And we'll emphasize more plants and more fish as a source of the fats. And it's only been in the past couple of months that we now are leaning into an entirely plant-based option for people. So I think starting in the next couple of weeks, we'll relaunch the app. And when you download the app, you'll have an opportunity to identify whether you're entirely 100% plant-based or you're sort of more plant centric, I guess would be the better way to say it. Whether you want to see animals and fish specifically in your recommendations, your recipes, your meal plans, or whether you want it to be entirely based on plants. And this process is something that Carrie and I've been working together on for the past, month or so. And it's been one of the funnest and most enlightening things that I've ever done. And again, I sort of alluded to this. I did my own little experiment over, I think it was like a week ago to try this, because I felt like if I'm going to be, telling people to do this, I need to actually do it and see what it feels like and make sure that it's not going to make my head fall off.
What'd you think?
Well, I'm still alive. It was great. It was great. I'll say this. I'll be totally honest. I'm probably not going to become a vegan.
Yeah.
But I will say this. If I had to, I could easily do it. I felt great. It was definitely a different way of eating. It required like buying some things that I'd never heard of. Like Carrie mentioned nutritional yeast, and
I cannot believe you've never, and by the way, people listening, their ears are going to burn. Nutritional yeast is like once you join the vegan club, it's the first thing you get.
Right. So I hadn't heard of any of this stuff. Like I had to go on Amazon, order like an entire new pantry. My family thought I was crazy. And I think once I got used to it, it was fine. Like I said, if I had to do it, I could do it. I think I probably will continue to eat fish because I like it, but I certainly could. And I think as a result of this experiment, I definitely have changed the way I'm eating. Like there are meals that I make now that are 100% plant-based or vegan that I never would have thought about eating before. And even like my kids will eat them. So I've definitely taken something away from the experience. And I think I'm probably more plant-based than I was 3 weeks ago, and way more plant-based than I was 3 months ago.
I think what's interesting too that I love about what you guys are doing with keto is that not only does it provide an option to me for people that are plant-based that are interested in doing keto without doing the traditional keto, but I think it also provides an option for people that already have been following the keto diet, that have been following the meat, bacon, and butter keto, that are looking for a healthier option, or an option where they don't have to worry as much about their cholesterol and things like that. And so it's a nice option for pretty much everyone across the spectrum, whether you're an omnivore or whether you are, fully plant-based. It gives just a healthier option all the way around. And I mean, me and Spencer went through in the lipid episode the reasons why a plant-based keto diet would essentially probably help with regards to lipids rather more than hurt. But, one of the big points I think that everyone forgets when you're doing a plant-based keto diet that really does affect cholesterol is fiber. And people think that if you're doing keto, it's started to, in the past few months, really start to drive me nuts that keto is now lumped into just one category, because there's so many shades of the keto diet. Now I'm saying it's analogous to someone that follows a vegan diet, just abstains from animal products. That is totally different than someone that follows a whole food plant-based diet. And I speak about this at length because this was demonstrated beautifully by a paper, Satija, and they published in JACC in 2017. It was called Healthful versus Unhealthful Plant-Based Diets. She essentially showed that, a very unhealthful plant-based diet was just as bad for you as eating a standard American diet with regards to cardiovascular risk. So just like there's a different degree of plant-based diets, the same thing with keto diets. So now I'm beginning to think, oh my gosh, I can't believe I used to lump all keto diets into the same thing. You can really take a keto diet and make it very helpful.
Well, Carrie's laughing.
When it comes to fiber.
Carrie's going to laugh at us because, of course, she's known this forever, but I didn't know it before recently. And I think most people out there in the world don't know it because the keto diet's sort of been branded this thing.
And it's going to cost me thousands of dollars in therapy that none of you paid attention to me before. No.
Yeah.
Here's the thing, again, and I don't have really a dog in the fight as far as what people do. I just wanted to put out what it was that I was doing and that it worked so well. And it's been interesting to see what the reaction has been from both sides. I mean, that's one of the biggest pushbacks. The JAMA article that came out earlier this year that said that the keto diet is low in fiber. Well, we've all sat here and talked about the fact that the keto diet can be incredibly high in fiber. In fact, higher in fiber often than probably many plant-based people are eating at their baseline, even if you're, really looking at it. So there's just so many myths around it. I mean, I got into an argument on Twitter at one point with Dr. Noakes, Professor Noakes, who's like the big keto guy. And he's like, it's not possible to do it plant-based. And I'm like, well, at that point, I'd been doing it for like a year and a half. And I'm like, it is possible. These are my and everybody says, what are the protein sources? Well, it's lupini beans, it's hemp seeds, it's tofu, seitan, if you can eat,
it's
gluten.
The same protein sources that I have when I'm not doing keto. I mean, besides like lentils. I mean, I have to be honest, it's really not, now that I've done it, it's really not that different. Like you're still eating fruit, you're still eating berries, you're still eating tons of veggies. There's so much confusion out there with regards to keto that you're so spot on that I'm surprised even in the keto world that there was confusion that you could do it plant-based.
Yeah. And, I traveled this past week and I intermittently go back and forth with posting things, but I really made a point of posting what I eat while I was out and eating at different restaurants, and to show people that you can get these beautiful plates of food that are really satiating, even eating out. It takes sometimes asking, for a few modifications or things, but people do that anyway. I mean, if you're plant-based, you go into a restaurant and you say, can you saute it with, olive oil rather than butter? Or can you leave the salad dressing on the side? I mean, it's no longer, abnormal to ask for substitutions and different options on food menus. And it's really not that hard once you learn how to do it. And I would argue that the number of protein sources are effectively equivalent to the number of protein sources on an animal-based diet if you're not eating any of these plant-based sources of protein.
Exactly. And if you, and the fiber stays the same too. So actually one of the biggest things that happened, I don't want to make this episode all about me, but because I keep interrupting you guys, but I have to say one of the biggest things I noticed when I did my experiment was that I always thought the keto diet had no fiber. And I never do dietary logging for myself ever. I've just always been at a weight that I'm happy with. And I've never done any dietary logging. Like I tell my patients to all the time, but I never really do Chronometer, MyFitnessPal, whatever. So when I did this vegan keto experiment, I had to log. And the biggest thing that shocked me was that actually I was like, wait, because I logged pre-experiment just to see the differences in my macros. And I realized that my fiber didn't change much at all. And I was like, wait, that's so shocking, because I was going on this high fat diet and the fiber didn't change. And that's because fiber doesn't calculate into whether, it doesn't matter how much fiber you have to be in ketosis. Fiber is neutral.
And you were clearly in ketosis. I mean, your urine strips showed that you were clearly in ketosis, because I've heard some people push back and say, oh, well, you couldn't have been in ketosis, but you were in ketosis and not using things like coconut or MCT oil or anything like that.
Well, no, sorry to interrupt. I would say I was also in, when I did mine, I was definitely in ketosis. I measured it 3 different ways and probably even higher levels of ketosis than I was not. And I definitely, I didn't track my macros, but I guarantee you my fiber intake was twice what it normally was. I mean, it was crazy. So
tell us how you know that.
Yeah.
Well, you really want me to be graphic?
No. But so the thing that was shocking to me, and for anyone listening that's plant-based and you're like, how is that possible that your fiber stayed the same? The reason it was surprising to me is that because fruit actually, and I love fruit and fruit's healthful, but fruit actually does not have that much fiber. And the fruit that has a lot of fiber, you can actually eat when you're on the keto diet. So the highest fiber fruits like raspberries, blackberries, strawberries, stuff like that, you can eat while you're doing keto. So I was so shocked to see that my fiber did not change. And I think that a lot of people in the plant-based space and everyone listening right now was also shocked because I'd never done the tracking before. So all the things that have tons of soluble fiber. So soluble fiber is the important part of fiber that we think of when we think of binding bile and lowering your cholesterol. There's so many items with soluble fiber that you can eat on a plant-based keto diet. There's just so many reasons why you can make it helpful. And it doesn't have to actually be that much of a departure from your regular plant-based diet, just shifting the macros a lot. I don't know. It was most surprising to me because I think I thought it was going to be this imaginary thing. I actually bought, when I started the experiment, I bought the, what's that called? The MCT oil, right? Remember I bought it because you were like, you may need it. And then I tried like a teaspoon and I went to throw it up. So I couldn't, but I didn't even need it.
Yeah. I mean, MCT oil is a way that some people can utilize so I have some patients that I want them to get to therapeutic levels of ketones for very specific purposes. And I think it can be helpful for that. I think it can be helpful for people who early on struggle to get into ketosis because of a lot of metabolic dysregulation and they're, already low carb, but they need that little extra help. But in general, I do not recommend people use MCT oil as part of, I don't use it. I mean, I haven't used it in years, so.
I never use it.
And the other important thing that I think to note is that, so regardless of what macronutrient profile you are following, to lose weight, you need a caloric deficit. So even on keto, Carrie, I remember you told me in the beginning when I did it, you said that's the biggest, confusion. People think they're going to do the keto diet and lose weight right away. And a lot of people do, which is water in the beginning a little bit. And then you actually do lose weight, but you lose weight in the setting of a caloric deficit, right?
Yeah. I mean, here's the thing. There are those who are out in the keto space that say you can eat, 4,000 calories and, at least remain weight neutral. And some people, if you're exercising a ton, you may be able to do that. I mean, there are days because I go for a, 6-hour run that I may need to eat a ton of calories. And obviously that math works out.
On any diet. Yeah.
Yeah. It doesn't matter. But I mean, I can tell you, I'm a middle-aged woman that's perimenopausal and calories matter. So, if I want to maintain my body composition and my weight, I need to watch what calories I eat, but it becomes almost a non-issue because the satiety is so, overwhelming in the keto diet that it's much easier to maintain whatever your calorie goal is. If you're wanting to lose weight, I mean, that was the problem we had with you is we didn't want you to lose weight and you ended up losing weight.
Pounds. I lost 2 pounds and I didn't even want to. And
it wasn't water weight because it didn't come back as soon as you added carbohydrates back, you added carbohydrates back and, so you replenished your muscle glycogen and you didn't immediately regain that 2 pounds. So.
And I actually fought really hard to keep my calories the same. And it was really hard. It was really hard. I lost 2 pounds in 2 weeks with force feeding myself, which was not that pleasant.
Right. I lost 20 in 6 weeks without even thinking about it. I mean, that's
oh my God.
Yeah. I actually found a picture of me from 2010 the other day. And it was like, my kids were like, that's impossible that that's you.
Well, I mean, I think that the idea for the ketones, that being in ketosis causes appetite suppression is obviously quite clear. But I guess, again, this is another thing I know Spencer and I discussed, that maybe not for everyone, but for some people. Do you guys think that in general that there's any, there's this question that I keep getting as well, that there's any danger for being in ketosis in long term, even if you are doing it in a healthful way?
Well, I mean, I think the answer is we don't really know the answer to that. I don't know, Ethan, if you have any other thoughts on that in particular, but I can tell you so far, every single biomarker that I'm able to measure looks optimal, and I'm able to live a really busy life and, exercise a ton, which I love. So I don't have any data to suggest that I need to do anything else. And it makes managing my diabetes, like I can sort of set it and forget it most days. Now, type 1 diabetes is still, there are days where the wheels come off. It doesn't matter how perfect you are. But, the single biggest quality of life improvement for me is that I get to be a surgeon, a mom, a runner, a wife, like all of the things that really bring me joy in my life, and pay attention to my diabetes less. So, as far as for the rest of, is there on a diet like this where all of your biomarkers improve, can we extrapolate that out and say that there's, potential long-term benefit? I would like to be able to do that, but it's not been studied long-term.
It hasn't. I think there are some reassuring tells though, right? I mean, there have been kids on the ketogenic diet for a long time, right? For almost 100 years now, and they seem to be fine. And there have been, populations of people who've eaten relatively high fat, low carb diets, and individual people anecdotally have been on it for 30 years and done fine. So like Carrie says, like you have to make a decision. In my case, I feel great. I feel as good as I have since I was a teenager. and every marker I can measure looks great. So I see no reason why I'm going to come off of it. That may not be the case for everybody. I'm not going to say it's the perfect diet for every single person, but I think I'm comfortable as a physician. I'm comfortable with this answering the question of whether it's safe for me with an hard yes.
Is there anyone you would say it's not safe for?
I mean, I always worry about recommending anything like this in somebody who's pregnant.
Although,
would say,
interestingly, not to interrupt, but if you have gestational diabetes, it is effectively the low carb diet that they recommend as the primary treatment before they put you on insulin. So there's that.
Were you keto when you were pregnant, Carrie?
I was not.
I mean, I just say that because like that we say that about everybody. But to answer your question, Danielle, I can't think of too many examples. I think it has to be managed very carefully in people who have type 2 diabetes, not because I think it's dangerous for the obvious reasons, because it's dangerous because of what Carrie said earlier, that people can get hypoglycemic because they don't reduce their diabetes medications fast enough.
No, I agree. That's like the biggest thing I've seen with like lifestyle modification, even just with patients. I speak about this at length, and even with patients that follow a whole food plant-based diet. My biggest problem is my patients are so compliant. That's de-escalation of medications. I actually started a Bluetooth hypertension program. Me and my co-fellow did. We were finalists at a Google AMA challenge. We essentially have a Bluetooth blood pressure cuffs that get uploaded to our EMR that the patients are able to upload at like a regular predetermined format with their physician, and then the physicians can bill for it in the way that you can kind of keep an eye on someone's blood pressure as you're de-escalating medications as they're going plant-based. I've had so many patients that lose weight with aggressive lifestyle modifications so fast that they obviously become hypotensive, and of course it's a huge issue with type 2 diabetes with their insulin and stuff like that as their requirements drop as they lose weight.
Well, and sulfonylureas are another, like in the area. Yeah. I mean, in the area that I practice medicine, there are a lot of patients for whatever reason that are primarily being treated with sulfonylureas, which I fail to understand why, since that's not anywhere near the guidelines, but nonetheless they are. So I have to have really long conversations with them that, I mean, within 24 hours, you may need to dramatically decrease the amount of medication that you're taking. And, there are some, I have a friend who runs a clinic in West Virginia who utilizes this with patients to help optimize them for surgery. And he has many of his patients get the Freestyle Libre, which is a device that you wear that he can actually follow his patients to follow their blood sugars remotely. And he can text them and say, hey, what's going on if they're either going too high or too low. And these are type 2 diabetic patients that he's following. So, there's a lot of tools that, can be helpful. And it really, to Ethan's point about being able to measure with breath. I mean, so urine testing stops being effective after a while. Like I am deeply in ketosis right now. Like my beta hydroxybutyrate, I checked it earlier today, was like 2.5. But yet if I did a urine strip, it would barely show trace, because your kidneys start to hold on to those ketones. And then the breath meter then lets you know how much fat you're effectively metabolizing. So, and Ethan, correct me if I say something incorrect here, but my understanding of it is that, beta hydroxybutyrate is sort of available fuel, and then acetone, which you measure through breath, is burned fuel. And it's nice to be able to have that feedback when you're on a diet, because the scale, I mean, as a woman, you probably feel the same thing. Like over the course of a month, just with hormonal shifts, you can go up 5 to 10 pounds, even if you're effectively weight neutral, right?
I think my favorite potential mechanism is this reduction in appetite, that people aren't feeling as hungry, and so therefore they eat less. But there have been controlled feeding studies that have looked at whether there might be a metabolic advantage, specifically whether people's basal or resting metabolic rate, their energy expenditure that they have when they're just not doing anything, like they're idle in a car, whether that's increased. And I think this sort of jury is still out. There are two camps. They argue back and forth quite vociferously, but I think there may be some small but real increase in energy expenditure that happens when you go on one of these low carb, high fat diets, which means that you're just burning more energy at excess. What's more interesting is probably in people who are losing weight. Typically, if you have somebody who loses a lot of weight, their resting metabolic rate, their energy expenditure will go down. And that's a conserved mechanism to keep us from basically starving to death and chewing up all of our protein and muscles at times when food's not abundantly available. It turns out that people on low carb diets seem to do that much less, or maybe not even at all. That is that their resting metabolic rate stays the same, which is really important, because one of the main reasons people fail when it comes to weight loss is that you lose all this weight, your energy expenditure goes down, and therefore then the amount of that you can eat just to maintain your weight is reduced to where it was from the beginning. So this is like a very interesting, I think, scientific area.
Why is that?
Well, we don't know. And it's a big area that, like, if you ask, like, the two big names in this field are Kevin Hall and David Ludwig, and they will like write papers back and forth with each other every couple of months about, who's right and who's wrong. And I think, I try to stay out of the nitty gritty in terms of their arguments, but I do think that there looks like there's probably, and it would be fun to ask Kevin, but I think he'd even say that there's probably a small difference in resting metabolic rate. The problem is, like everything else in metabolism and nutrition, there's just so much confusion in terms of methodology and other things that you can sort of see things however you want to see it. But I think that's a really interesting idea, that maybe one of the other advantages beyond just feeling more full and being less hungry is that you're actually burning a little bit, or you don't have that compensatory decrease in your resting energy expenditure that happens when you lose weight, typically.
That's really interesting. I actually had never heard that before. I remember that they had, like, who was it who did the studies on the Biggest Loser people?
Kevin Hall. Yeah.
Oh, that was Kevin Hall.
Yeah.
Yeah. And it was like their resting energy was like insanely low, right?
Yeah. That's the problem. That's why people all rebound. Like if you look at any long-term nutrition study, like any diet, you'll lose weight in the first 12 weeks. Question is, how well can you maintain it?
Right. They were worse off long term than they were if they had never done the diet.
Wow. Oh my gosh.
Look, some people think that that's because they lost so much weight so quickly. And like, there's all this other question about, how you work in and exercise. And I think a lot of people think that exercise is not a great way to lose weight, but it's a really good way to maintain weight loss. But I think there is probably some effect. I don't think it's as big as people might expect, but there is probably some effect. And again, even if it's just that you're neutral, that you're not decreasing your resting energy expenditure when you lose weight, that's profound, right? That combined with the changes in appetite, you can see why this could be pretty powerful.
So what is like the longest term study we have so far of people being on keto? Is it 2 years? Is it the Virtus study? Is that what we have with regards to compliance and how people can really actually stick with it?
That's the longest one that I know of. I don't know, Carrie, do you know of anything longer?
Yeah, I mean, there are much longer ones on kids that are being treated with epilepsy. It was funny. So I was at a conference this weekend and I just showed published data, and a woman came up to me afterwards and she was like, here's the thing, plant-based diet, like keto diets are not sustainable. And I said, well, show me data that shows that a less than 10% fat plant-based diet is more sustainable than a well-formulated low-carb diet. And oh, by the way, 20 years ago, I was diagnosed with celiac disease. And so, her argument was that it's restrictive and it's hard to be on, which I'm not sure why well-formulated low-carb diet is any more restricted than, a whole food plant-based diet. There are things that you cut out, mainly processed foods. But, 20 years ago or actually 25 years ago now, because I just keep getting older, when I was diagnosed as having celiacs, they said for the rest of your life, you're going to be on a gluten-free diet. And at no point did anybody say to me, it's really restrictive, it's going to be hard, we know you're not going to be able to do it. They just said, you're going on a gluten-free diet. And even every single type 1 diabetic, over the course of history, diet has played a substantial role. In fact, the low-carb diet prior to insulin being discovered by Banting, the low carb diet, the keto diet, was how they kept type 1 diabetic children alive. And for a long time in type 1 diabetes, carb restriction was one of the primary tools. Eating as a type 1 diabetic is always, we have to count and pay attention to everything. Like there is very little Zen eating when it comes to, although the low carb diet is the single closest thing I have to being able to, not have to micromanage everything that I eat. But it's not that restrictive of a diet. It is a different way of eating, and it takes embracing that. But for me, it's incredibly sustainable. And probably the biggest reason is because I feel so good. And as a middle-aged woman, I don't have to worry as much about gaining weight as I have with the other things that I've done throughout my life.
Absolutely. Well, I think that you've obviously proven that you can stick with it for a long time and be really, really, and thrive with it. It's worked for your lifestyle. And I think you've totally changed my outlook on plant-based keto completely. How many years total? What's your total years on it now at this point?
For plant-based, more than 3 of strict plant-based. I had some animal protein prior to that. I've been in ketosis for 7 or 8 years now.
Oh my God.
Total.
Wow. Amazing. Thanks, both of you, for coming on Nutrition Rounds. The first time I've had 2 people in ketosis on my podcast, which 6 months ago I would have not done. But now I'm very, very excited for all that you guys are doing in this space and for interesting research that's going to emerge. So thank you both for talking about this today. And so now it's time for you both to plug where everyone can find you, where they can find you on social, where they can find your company, everything.
I am on Facebook as Carrie Diulus MD and Twitter as CA Diulus and Instagram as Carrie Diulus MD. And as we talked about earlier in the podcast, my clinical practice, which is almost entirely spine care, surgery and everything around that, is at the Crystal Clinic in Akron, Ohio.
Awesome.
And so before I tell you where you can find me, I just want to thank you both because before a couple of months ago, I didn't know this whole thing existed, and it's definitely changed my life. And I think it's going to change a lot of other people's lives. So I want to thank you both for opening my eyes and having an open mind. So you can typically find me, although I don't spend as much time there as I used to, on Twitter, and I'm at Ethan J. Weiss. I also, before a couple of days ago, basically never went on Instagram, but now have this new Instagram following that I don't know what to do with it. And
wait, everyone listening, please make sure you, of course, I want you to follow Carrie. You have to make sure you follow Ethan because he has to learn how to use Instagram. So make sure you send him a lot of DMs. Ask him all of your questions.
Please do that.
He's very open to it.
Please. What you're going to see on my Instagram feed is like a lot of pictures of my depressed yellow lab and some of my kids like skiing, playing basketball. And then the other thing,
they can find you at, what's your Instagram handle?
At Ethan J. Weiss, same as Twitter.
Okay,
and then, I think I alluded to, you sort of talked about this company that we have founded and that Carrie's been helping us with. And that company is called Keto. And I want to just tell everyone that as of, I don't know, sometime in the next week or so, we're going to have a link. So the website for our company is getketo.com. But if you do /plant-based, all one word, you will find a link to the brand new plant-based app that we're releasing to the public in the next few days or weeks. And I think we'd love to hear feedback from people about what they think of it. Please, because I know nothing about plant-based nutrition. It's only because of Carrie and Danielle that I'm even talking about it. So we'd love to hear how people feel about it.
And so for anyone that's interested, you can also get the keto device also through the same place, right?
Yeah. So the same link, that getketo.com/plant-based, you'll be able to get the device and also download the app.
And I have to recommend you do get the device for anyone listening, because every time I've gone into ketosis, I pee on those strips that I pee on myself, and it's just not, it's like the worst. So just get the device. You have to send me one. I want one now.
Okay. I'll send you one. Right now.
Great. All right. Well, thanks, guys. And for everyone listening, I am super pumped for you to try it. If you are going to try vegan keto, make sure you tag me, Carrie, and Ethan so we can see what you're experiencing. And also make sure to tag all of us, plus Dr. Kasey Johnson, in your post when you listen to the podcast. All right. Thanks, guys.
Thanks so much, Danielle. This was awesome to have this opportunity.